Welcome everybody to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. My name is Madeline Golick. I'm the owner of Ecophysiotherapy as well as the pelvic floor physiotherapist here. And my guest today is Agustina. Welcome to the show.
Thank you. Thank you very much.
So I thought it would be only appropriate for us to have this conversation because we're really happy to report that Agustina is now part of our Ecophysiotherapy team.
That's right.
And she is a registered psychotherapist. Mm-hmm. Now, do we have to say the qualifying part?
No, that's fine.
Okay.
But, yeah.
Well, so she's a registered psychotherapist. And so I thought this would be a great opportunity for us to get to know you a little bit better.
Yeah,
so
absolutely.
why don't we start with, why don't you tell us a little bit about you?
Yeah. So first and foremost, I want to say thank you for welcoming me into your team. My name is Agustina, and I'm a registered psychotherapist under the College of Registered Psychotherapists of Ontario, under the qualifying realm, which means that I work with supervision.
Yeah.
What I did for my undergrad studies, I studied psychology, neuroscience, and behavior at McMaster University. So I did a Bachelor of Science there. And then I really liked the aspect of kind of how psychotherapy interacts with the psychological part, neuroscience part of how you see somebody and how you conceptualize a person. So then I went on and I did my master's at the University of Toronto, specializing in counseling, psychology, and psychotherapy. And then I became a member of the college, and now here I am.
Yeah,
so that's me in a nutshell.
Yeah, a mouthful, which I think, is the perfect opportunity for us to kind of maybe break it down for people about like what actually is psychotherapy, and is there a difference between psychotherapy and like a psychologist? Because I'm sure people are wondering if what
differences.
Yeah.
Yes, absolutely. So psychotherapy, to give a basic explanation of what it entails, is a treatment of a mental health disorder or a struggle. So it doesn't have to be a mental health disorder.
Okay.
That's treated through a psychological means rather than a medical means. So what that means is psychotherapy will not prescribe any medication. We are not qualified to do that. And we come from an approach that a psychological concern, a struggle, or a diagnosed mental health disorder can be managed and can be resolved with psychotherapeutic tools. Mm-hmm. And there are different tools that can help us delve into that in order to make the person feel better and regain quality of life.
Yeah, and I think that's a really important thing that you brought up about, yes, we're talking about dealing with mental health issues, but we are also talking, you're also pointing the fact that like we all have struggles. Yes. And we all have moments in our lives where life gets really hard or, something happens that it's sometimes hard to see the forest from the trees when we're in a situation, and sometimes having somebody from the outside to guide us carefully to walk through our feelings and our emotions to make sense of it so that we can actually come out the other end. I heard a term like post-traumatic growth. Right? You can have post-traumatic stress and you can have post-traumatic growth where you have an event that happens in your life that can either take you down a not so pleasant road or actually makes us grow into a more, well-rounded, functioning individual in society.
Absolutely. Yeah.
So
you got it right on. A big part of that is that every person that comes into psychotherapy, they have a history, and we all have a history. So you have a history, I have a history. But what really matters is what is my story about that history?
Right.
And that's what we're trying to do. Some histories may have a lot of abuse and trauma. Other histories may not have as much abuse and trauma in the picture. But psychotherapy is basically looking at that history and what is the story? Can I change the story so that that history is not shaping me in maladaptive ways today?
Right. Because it's true. Like in research, when we're talking about pain, like how an individual processes, let's say an injury, let's say like a car accident, right? How a person processes that experience is going to be dictated about how other members of their family deal with stress and
Yes,
illness,
yes.
and maybe past experience. Maybe you had a good experience. I broke my ankle. They took really good care of me. I was great, and I healed, and so you feel really confident in your body's ability to heal. Maybe there was something else that happened. Some complicate, right? So it all depends on what we've experienced. I think builds our perceptions.
Yes.
And also drives our decisions that we don't even know that it's the driver.
Yeah, absolutely. Yeah. And it could be as something as, for example, if when I fell and I was little and somebody would be afraid for me, and every time I fell, it's the parent that gets up and says, oh my God, we need to take you to the hospital, or we need to take you somewhere, or the parent has that anxiety. It actually comes onto the child. And then as a grown-up, that child, every time he or she falls, may have that anxiety of, oh, now I'm bleeding, now this is going to get bad, now I have to go to the hospital. And before you know it, there's all of these afterthoughts that are completely misinterpreting the event,
the actual and so I guess that's where different tools might be coming in. So maybe we could talk a little bit about what are some tools that you would bring into a situation to help a person?
Sure. With psychotherapy, an easy way to understand it, it's like when somebody studies engineering, right? So they become an engineer, but then you have different routes. You can go into civil engineering, you could go into electrical engineering, you could go into mechanical engineering. Psychotherapy is much the same way.
Okay.
Within psychotherapy, you have different approaches.
Okay.
One approach that I'm sure everybody or most people have heard of is the cognitive behavioral therapy approach, or CBT for short.
Okay.
And that tends to be a very practical way of resolving the symptoms as they're happening now. Okay. So it's more it involves a lot of psychoeducation from the therapist to the client about what's the relationship between a sensation, what's the thought about the sensation, and then do we believe the thought that we have about the sensation, and what's our feeling consequences of that. And then there are other therapies that are more, they're called emotion focused or psychodynamic therapies, or humanistic therapies, that are more about the talking rather than the doing. So CBT can be more about the doing. The person coming in can get sometimes homework exercises or strategies. Okay, so if we're feeling anxiety, this is what we can do, and this is how we lower it down. Whereas with the other therapies that I've mentioned, such as psychodynamic or more humanistic, it becomes more about the talking rather than the doing. So we start conceptualizing, okay, when I was a child, this is how things were dealt with. I'm wondering how much of that I'm taking with me. And how helpful is it today when I'm an adult and I'm no longer a child? Those are the different therapies. Now, what therapy would I be using with a person? It really depends on what the person wants. Some people work in a much more structured level, so they like having that homework, the tracking of their thoughts, tracking of the feelings. What are the triggers in this situation? How do I cope when I'm in this position? So CBT would be great. CBT maybe paired with some mindfulness would be really good. They're to-do therapies, right? And some people may come in with more general issues, like perhaps maybe death anxiety, and how do I conceptualize that, and what does that mean to me, and making meaning out of their story. So then we might sit back a little bit as a therapist, not do so much of the guiding that you might see in CBT, and really let the client kind of guide us a little bit more. And then the mindfulness piece as well. You do some work with that as well. What you mentioned, emotional therapy. What's that look like? Emotion focused therapy is based on the belief that we have primary emotions. So, for example, a child is born, and within a few weeks of life, we can see that the child smiles, right? And there's happiness that evolves quite quickly in the child, sadness, anger, and those are primary emotions. And then we start having secondary emotions, which are almost like emotions about the emotions. And when I talk about emotions, it's feelings. So emotion-focused therapy tends to really have the person explore what's the emotion there. And an example I give of this is when we're walking down the street and we trip. And there's people around us, the first thing we do is we get up and we, might swear a little bit or act a little angry. But if we go a little bit below the surface there, it's really more embarrassment. We are
Right.
embarrassed that we fell. We're embarrassed that people saw us. But our way of covering that up is to look angry, because that is much more acceptable to us than actually feeling that embarrassment in front of everyone
That
else.
vulnerability, that,
Yes.
you know, feeling human, really, right? And that
exactly
we all
it. Yep.
make, you know, we all have our little foibles, I
Yes.
like to call them, and
Foibles,
certainly, but, you know, and even going into that is you know, you have the feel. Well, I think you said it. Feelings,
Yeah.
which are sensations and emotions. One of the things that I'm learning about is like it's felt within the body. We feel it in the body. So we
Yes.
might, you know, mentally or cognitively try to dissociate or move away from our feelings and emotions.
Yeah.
But the actual physiology of those
Yeah.
things actually stay present with us.
Yeah.
Whether we're aware of it or not.
Yeah.
And I think that's an important aspect that is not always given as much
Mm-hmm.
attention, because we think of mental health, we really don't talk also about emotional health
Yeah.
and trying to understand what role that plays in the construct of our whole experience of life.
Yeah, and that's talking about the relationship about emotions or feelings and mental health, right? And research shows that people that are able to respond to their emotions more adaptively tend to have more adaptive or more favorable mental health. So the ability of recognizing, okay, right now I'm angry, and this is how I'm going to respond to this by backing away, regathering my thoughts, and saying, okay, I'm going to let this time go by so I'm not so angry. I'm not reacting on my anger, but rather I'm reacting to the situation. And having that level of insight greatly impacts mental health in a good way if we're able to adjust to what the emotions are. Yeah.
So let's maybe just highlight also, you know, because I think psychotherapy also has a lot to offer, you know, for individuals that are maybe looking to optimize their interaction. So maybe there isn't a mental health issue.
Yeah.
Maybe there isn't a grief or an event happening. Maybe can people benefit for self-development and self-optimization? Because, you know, I'm looking at it from the perspective of let's say like a business owner trying to juggle family and work. And, you know, when you're an entrepreneur, like you're facing failures all the time, right? And you're facing stress all the time. And how can we better develop coping strategies to move through these difficult situations? And I feel like psychotherapy has done me a great service in that way of helping me figure out, okay, how do I work around some of this negative self-talk that happens when there's something not going the way that I want it to be going? So I think I just think it's important to highlight that, not necessarily because there's a problem. Maybe like for myself, it's like if a problem arises, I just want to know that I'm optimizing my ability to cope and not become overwhelmed, so that, you know, I'm not being pushed into emotional reactions.
Right, yeah, and you're preventing that kind of breakdown. And that's exactly it. So some of the clients that come in to do psychotherapy, a lot of them don't have a diagnosed mental health disorder. And then people ask, well, what is a mental health disorder, right? Well, some people have clinical depression and it's been diagnosed by a certain physician or a psychiatrist or a psychologist. Some people are going through a life transition. So whether it's children moving out of the home and then now what is the meaning of my life, right? Sometimes it can be about job loss, divorce. Those are all big losses that can impact the level of functioning that someone has. And exactly like you said, psychotherapy, if you think about it, it is 1 hour that is devoted, right, between two people in which the therapist brings nothing of him or herself to you as a problem. And you're just receiving everything that the person is feeling. And when we think about how many times do you have that kind of unconditional 1 hour to yourself where you can take the time to explore every feeling that goes on, what you're feeling, what you're going through, it's very, very difficult. And some people have friends and they say, well, what would it be the same as talking to a friend? But then we start blurring the lines of friends tend to sometimes give advice, where psychotherapy is we facilitate you finding the best tool for you.
Right. So like a lot of self-directed,
Yes.
we can't do it for you. We can help guide you so that you can find the route that works best,
Yes.
best for you. So I think that can be extremely valuable and helpful in really any situation.
Yeah, absolutely.
Right?
Yes.
And sometimes just being able to talk to somebody who has no participation or like no active role in the situation, just through the act of hearing your own self say it out loud with one or two questions to guide you to dive a little deeper, can really help you unravel a lot of insights that are underneath the surface. They're like within you, but you just can't seem to get the way to get them out. And so I think, there's a lot of techniques to help draw those things out.
Absolutely. Yeah.
So I guess so we kind of already covered some examples of different clients you sort of might be seeing. Maybe you could talk a little bit about like what clients might expect in a visit, like what might happen.
Absolutely. So in a first, psychotherapy above all is a process, right? And actually the one thing that guides success of a therapy is the rapport that's developed, or the therapeutic alliance, as more scientific terms like to call it, the rapport that is developed between the client and the therapist.
Yes.
So the stronger that rapport is, the more successful that therapy has the chances of being. So in the first session, we really try to get to know who the client is. So we listen to the client's story, and we're listening for different things. As a therapist, we're trying to sense. So we're trying to really have a sense of how the client conceptualizes the world around him or her, who the client is bringing up as support networks. Do they talk about kids? Do they talk about a spouse? Do they talk about support networks, or do they have very little supports? There's a lot that the client brings that is unsaid, right?
Yeah.
So as a therapist, we sit back and we really sense what the client brings into the first session.
Yes.
And then we try to conceive, okay, what is the client really trying to tell us? He started off the session by telling me this. Now we're at this point. What is she trying to put together? And then we interpret, okay, this is what may be happening. I have an idea that this is the route maybe that we want to take. So the first session is really getting to know the client, asking those questions, like you said, that might reveal something else that is going on at the time. Most of the times clients come in with one concern, and it's actually something completely different that we're working on.
Yeah.
So it's getting a sense of that. So the first few sessions, I would say, call them assessment sessions, where we're really trying to assess where the client is at, what are the issues at hand, what are we trying to solve, and then we pose to the client, okay, this is the way I work, this is something that might be helpful to you. And that's generally how we work. The best, I think, route for psychotherapy to be successful, or to set it up for success, is, again, having that good rapport with the therapist. And then also making it consistent. So as consistent as possible. So if we meet on Tuesdays, let's try to keep it for every Tuesday, once a week. And then as we start seeing progress, then maybe it can be once every 2 weeks or once every 4 weeks.
Right.
But really leaving it as a process, leaving too much of that kind of anxiety of wanting it to work. It's a process, right?
Yeah. And the commitment and the courage, right? It's the courage and the commitment to stick with a process to get the results that you want. I think that's true for any therapy, whether it's physiotherapy or chiropractor or psychology, or, these things didn't just show up. In most cases, they didn't just show up from nowhere, right? So it takes some time to delicately maneuver and really get to the root causes of what's causing your shoulder pain, or what's causing you to feel so bad about this situation. Like, what led us to this point? So really, it's a process, and you have to be involved.
Yeah.
You're it has to be an active participation in the process for success. Same thing with physio, right?
Yeah.
If you're not going to, if you're not going home and kind of doing some of the exercises, you can't, you might not see the same type of results,
absolutely.
right?
Yeah.
I wanted to maybe talk about, why would addressing emotions and mental health, like why, or just not even mental health, but just the way that we think and process, like why is that important for us as individuals to consider as part of our holistic treatment plan?
Yeah. Well, we are we are physical beings, and we have a head that's being attached to the rest of our bodies. And so that kind of parallels what goes on in the psychotherapy world, is that whatever goes on here impacts the rest of our bodies, right? And we see that a lot in depression. So sometimes kind of the emotion can set up the body to feel a certain way. And what we see in depression is kind of the slouchiness. So even if we look at the physical symptoms, right? People not getting out of bed, and they'll say, somebody going through depression will say, you know what, it's not that I don't want to get out of bed, it's that my body hurts.
Yes.
Right? And they indicate pain. And they say, you know, since somebody died, or since that loss that they suffered in their lives, I've been feeling like this, and now I'm having this physical reaction to it, and I don't know how to deal with it. So it's this connection, right? You can't have one without the other. Same thing can be said about panic attacks. People suffering panic attacks, they feel the palpitations, the physical reactions, and then they have the emotional response of, oh my God, I'm going to die, I'm going to lose control. Right?
Yeah.
So sometimes it's the physical coming in first, followed by the emotional, and then they start looping into each other.
Yeah.
Right.
And we see that oftentimes with, you know, chronic pain. Symptoms is usually there's an interplay between, you know, depression, anxiety, and physical pain, because at the end of the day, emotions are physical. They're physical sensations. It's our physiology responding to something, and it's oftentimes asking us to look at something that it wants our attention or needs to be looked at it. And, you know, are we set up to understand what the body is experiencing? And if we don't understand, and there's a disconnect between mind, body, then we run into all sorts of different issues, right? And so that's why I think having somebody to provide that aspect is so helpful with what you know, we as physiotherapists, we're working on the body. We're trying to get you connected with your body. Sometimes there could be a disconnect that the mind does not want to connect with the body. And so that's sometimes why pain persists. Because we're not really addressing what's driving the pain. Sometimes it's such a intricate interplay between you know, mind, emotions, and the physical sensations that really, to approach especially you know, a chronic pain situation, we really need to look at the whole picture in order to really help that person move forward, right? So we need movement, we need feeling, we need to, you know, sense our body, but we also need to sense it from within.
Yeah, absolutely.
Right?
Yeah. And a lot of that too is seen, sometimes people may come into psychotherapy for substance use, right? And a lot of substance use is you're picturing this great alleviation of whatever pain it is through the use of that substance. So a lot of the times it's said that the person relapses before they actually physically relapse, right? It's in their mind, their neurons are wiring together, and they're saying, yes, I'm driving you to get this because this felt so good in the past. Go get it. And that puts our bodies into motion to achieving that drug of choice or whatever it may be.
Whatever substance, to numb. I heard a great saying by Dr. I think his name is Gabor Mate. He said, with respect to substance or addictions, really, it could be addiction to anything. It doesn't even need to be a substance. It could be anything. He said, you know, or his words were, why it's not why the substance, it's why the pain.
Why the pain,
right? Because really, the things that we do, the choices we make, if we're feeling a pain, and again, that can be an emotional pain, right? It can be an emotional, physical sensation. So, and of course, it turns into it is a physical sensation as well. But we want to make it go away. And if we don't have the right tools or the right conceptualization or even the right understanding of what it is I'm actually feeling, right? Is it dangerous? Is it not dangerous? Am I safe? You know, does it mean something bad is happening to me? Right? There's a lot of thought process that goes around the sensations. And if we're not connected, then we're not confident within our own bodies. And when we're not confident within our own bodies, right? We just want to numb it down, right? So the substance makes us feel better because it takes that unpleasant sensation away through numbing. But when it wears off, guess what's still there, right? It's still that underlying sensation, right?
Oh, absolutely.
So it's not why the substance, but why the pain.
Why the pain, that's exactly it. Yeah.
Right?
Yeah.
And then our jobs from health as healthcare providers is what is the best way that we can help you understand what that pain is, what's driving the pain, and how can we get you moving physically, and how can we get you thinking differently so that really it's impacting the same thing. We're just taking a different approach of trying to basically talk to the nervous system.
Yes, absolutely.
Yeah.
That's exactly it. Yeah.
So that's why I'm so happy that you're part of our team, because this is really important work, and I think this can't be undervalued. It's so important for overall health, and especially when we're talking about chronic pain and depression, anxiety, because we know those numbers are going up.
And they cluster together, right? It's the chronic pain,
exactly.
the anxiety, the depression. Yes, absolutely.
So I wanted to thank you for just coming to do this impromptu video to help our audience sort of understand a little bit more about what you do. So we will have you'll have our contact details, and if you feel like Agustina might be able to help you with something that you're working through, or you think that we can take a interdisciplinary approach, maybe you have some chronic persisting pain, or we can certainly help you with that. So get in contact with us, send us an email, send us a message, and we'll do our very best to get you to the right person to help you. So thank you again.
Thank you very much.
All right, and thanks for watching, guys. See you later.
Thank you.